What if your understanding of therapy could change lives? Today, we're diving into crucial aspects of trauma-informed counseling. These include boundaries, confidentiality, and informed consent. These elements form the backbone of ethical practice. This is especially important in volatile settings where vulnerable populations seek help. Let's begin with boundaries. Boundaries are essential in therapy. They protect both the client and the practitioner. For trauma survivors, boundaries help create a safe space for healing. Practitioners must establish clear, consistent boundaries. This creates a sense of safety and predictability. However, cultural differences can significantly influence how boundaries are perceived. It's important for therapists to discuss these aspects directly with clients. Doing so encourages openness about preferences and concerns. Next, let's talk about confidentiality. Confidentiality builds trust in therapeutic relationships. It's especially important for trauma survivors who share sensitive information. They need to know their disclosures remain safe. Practitioners have a legal and ethical duty to protect client information. However, there are limits to confidentiality. There are situations where disclosure is required. For example, if someone is at risk of harm, practitioners must communicate these limits clearly. This ensures clients understand their rights within therapy. Now, let's explore informed consent. Informed consent isn't just a one-time event. It's an ongoing conversation throughout the therapy process. Practitioners must discuss treatment, risks, and alternatives. In trauma-informed care, it's vital to consider the client's vulnerabilities. Trauma can impact a client's ability to consent. Practitioners should regularly assess a client's capacity to understand information. So what happens when a client might harm themselves or others? This creates an ethical dilemma. Practitioners must navigate the fine line between autonomy and safety. Sometimes, full disclosure about confidentiality limits can deter clients from sharing vital information. This requires careful thought and consideration regarding how to communicate these risks. With this understanding, we can see the importance of an ethical decision-making framework. This framework guides practitioners in complex situations. It emphasizes autonomy, beneficence, non-maleficence, justice, fidelity, and veracity. Each principle adjusts according to individual and cultural circumstances. This approach helps practitioners balance ethical principles in challenging environments. Integrating these skills and principles supports effective trauma-informed care. Practitioners should reflect on their practice. Are they maintaining ethical standards? Are they embodying trauma-informed values? This self-reflection ensures comprehensive care for trauma survivors. Now, let's focus on self-care. Working with trauma can take a toll on mental health professionals. It's crucial for practitioners to establish self-care practices. Lightening the emotional load enhances their ability to help others. Organizations should support their staff through supervision and peer support. This builds an inclusive atmosphere and promotes well-being for all. To summarize, the integration of boundaries, confidentiality, and informed consent in trauma-informed counseling is essential. These components create a framework for effective, ethical practice. Practitioners must prioritize their own well-being while supporting clients. By embodying these principles, we foster healing, resilience, and recovery for trauma survivors. Are you interested in learning more? Subscribe to our channel for more insights on trauma-informed care. Let's continue to support each other in this vital work.